what are the risk factors for osteoarthritis? Well, the age is the most potent risk factor, right? Let me make this statement again. Age is the most potent risk factor for osteoarthritis. Okay. In fact, there are hardly few situations where you may get osteoarthritis before the age of 40. Right? So otherwise, most of the cases of osteoarthritis are diagnosed after 40 years of age. Typically, like if the osteoarthritis is triggered by the joint trauma or joint instability, right, or malalignment, then you may encounter osteoarthritis before the age of 40 years. Otherwise, you are diagnosing osteoarthritis after the age of 40 years. Female gender is an important risk factor, especially postmenopausal women are particularly more at risk. Postmenopausal women are particularly more at risk. And we all understand the importance of obesity. We know that the weight-bearing joints are very frequently involved in case of osteoarthritis, and thus obesity is an important risk factor. Right? So probably this is the second most important risk factor after age. After age, this is the second most important risk factor. And if they ask you what is the most common modifiable risk factor, obviously that is obesity, right? Now coming to genetics, genetics probably doesn't play an important role, maybe a minuscule role, but we still have observed certain findings in the sense that there is a subtype of osteoarthritis called as nodular or generalized nodular osteoarthritis, which is seen to cluster in families. That typically affects females more and has a tendency to have a familial occurrence. So thus there may be some role of genetics. So for what we have observed is that certain polymorphisms in gene called GDF5, right? Polymorphisms in gene called GDF5 that confers higher risk of developing osteoarthritis. Apart from that, if you talk about HLA, HLA-A1 and B8 are considered as risk factors. Right. So remember, when we talk about other rheumatological disorders, especially the inflammatory arthritis like rheumatoid arthritis and other rheumatological disorders like SLE and all, very often we talk about HLA-DR-B1, right? HLA-DR-B1. If I have to talk about rheumatoid arthritis, probably HLA-DR4 also, right? But in case of osteoarthritis, it is HLA-A1 and B8. A1 and B8. They carry a slightly higher risk of developing osteoarthritis. Okay. Then there is also some relation between having this alpha-1 antitrypsin M2 phenotype and a slight higher risk of developing osteoarthritis. Okay. And the genome-wise association studies have found out certain loci on chromosome 2q, which basically houses the genes for interleukin 1 and its receptor alpha. Right. So certain polymorphisms in this location can confer a higher risk of developing osteoarthritis. Right. So that is about genetics. Now coming to another risk factor, that is trauma. Trauma is also considered as an important risk factor. So if there is, like if a patient has suffered mainly fractures running through the joint surface, that is a very, very important risk factor for developing osteoarthritis. Similarly, if there are joint malalignment, then the joint would be subjected to repeated trauma, and that is also considered as a risk factor. Okay. Then repeated use of joints and exercises can also be considered as risk factors. Repeated joint use and exercise. For example, hip joint osteoarthritis is very common among farmers because they are repeatedly subjecting their hip joint for use, right?